Because of the very small area within the mouth of a cat, it is sometimes not possible to get the sensor far enough in order to capture the apexes of the most caudal maxillary cheek teeth, or the molars and premolars in this instance. Up in this particular area, sometimes it might be very difficult to get up in there. So what we're going to show here is an extraoral technique where I have the sensor outside the mouth, and this is the only instance where we do not have the wire of the sensor coming out the front. Because of the fact that the sensor is now extraoral on the outside of the mouth, the wire is going 180 degrees opposite. It's going caudal towards the tail of the animal, as you can see over here. So here we have the sensor in position like so. What I've used is a small piece of Play-Doh underneath the sensor, and of course this would represent our wet table area here. So we can put the sensor with some Play-Doh down on the wet table in order to hold it in place, and then we lay the cat or the kitten down in such a way. I have a toothpick holding the mouth open. You may be using a mouth gag of some type, or possibly a syringe that's been cut into a piece where you can go between the points on the two fangs, the upper and lower canines, in order to hold the mouth open. I have rubber band and hair curlers and whatever I need here to help show how this is done. But what we're going for are the apexes of these teeth here, which are very close to the sensor. In fact, we can actually see a shadow outlining the teeth here, like so, on the sensor. And because those teeth are so close to the sensor, the angle of the X-ray itself won't make too much difference. But what we do want to do is bring the cone in like so, and we want X-rays that are coming out of the cone that are hitting these upper left or quadrant 2 teeth to project them down and miss the sensor and hit the table. The objective here is that X-rays coming through the apex of the upper right or the quad 1 cheek teeth will be recorded down on the sensor like so. So as you can see, if our angle is too steep like so, we're going to superimpose these upper left teeth with an image of the upper right teeth, and that is something we don't want to do. So if we are getting these upper left teeth on the sensor along with the right ones, we're getting essentially a double image. We need to make that angle more shallow. So you can see here we're a bit steeper, and here we're a little more shallow. There's no bisecting angles that are considered here. This is just a matter of visualizing the image. This is very much like contact radiography, just like you're using your standard whole body radiography table, where the body of the animal's on the table very close to the film, and we're hoping to get a projection through the open mouth and make essentially a contact radiograph of these teeth. And if we get the angle correct, we may see something like that as a result of that. Now, an alternate method is called the near parallel. If we cannot get the sensor up against these teeth very close over in this area, we go to the opposite side of the mouth and we put it in catty-cornered like so in order to accommodate the size of the sensor. And this is called a near parallel technique. And when we bring in the X-ray, we're looking very close to the bisecting angle. So you can see where we're pretty close. It is almost parallel because our sensor is like so. Our teeth are about like that. So we have a pretty acute angle in between like that. And we might get an X-ray such as this as a result of that.